Hi everyone, live from CalJam again, and this time I have Dr. Suzanne Humphries, who's one of my major heroes. So I'm really excited for this video and to meet her and talk to her more. I've met her once before, but of course that wasn't enough. And she's here at CalJam speaking about her latest book called Rising from the Dead, and it's an amazing book. Everyone should get it. And I wanted to ask her what she's going to talk about tomorrow at the conference.
Well, I can tell you kind of what I'm going to talk about, but I can also tell you that people can live stream it. If you go to Dr. Suzanne Humphries on my webpage, and you'll see how you can go and live stream it for a cost, but the cost goes to charity, 100% to charity. So if you can't get here, you can go and check that out. So the title of my talk is Vaccination, Manipulating a Mystery. And it's basically my opinion on the potential for having safe vaccines.
So, what is your opinion on safe vaccines?
Well, I think I'd rather tell you that tomorrow night rather than tonight.
All right.
I don't want to, you know.
You don't want to ruin it?
Here. Yeah, definitely.
Well, you can live stream it on her Facebook page. And also, does anyone have questions for Suzanne? I know we have a lot of people out there who love all of her work and Dissolving Illusions. Oh, by the way, I share that book all the time and all of the research that went into it. So I think it's one of the keystones of the foundation of really proving that diseases didn't decline necessarily because of vaccines, not like we're told. And, you know, it's really about profit over health. And I really, you know, I love the way you speak because you tell the truth, right? And like the full truth and not maybe, you know, sugarcoating it or anything like that. So I really appreciate that because, you know, it's important that we have a lot of truth tellers in the movement and, you know, getting that information out there. So
I think we should thank Roman Bystrianic also.
Yes.
Because like I get all the blame for the book, but he should get all the praise really because it was his idea to write the book. He started it, he found all of the data, he made all the graphs himself, he did most of the historical research, and then I wrote the medical stuff. So it was a collaborative effort, but without Roman, there would be no Dissolving. Trust me, I would have never been able to do that book on my own. I look at that book now and I just go, wow, like
That's great.
I don't know how this happened, but yeah.
Because I love that book. I mean, so for those of you who are still a little bit new to all of this, Dissolving Illusions is an amazing book that shows that really what we've been told about vaccines saving us from all of these epidemics and all of that is not the full picture, and it goes into, you know, the historical data. There's great graphs on there, and you know, they really did a ton of research into the historical data, the real history, not the pharma propagandized history that, you know, wants to sell vaccines at all costs. Well, at the cost of our health.
If you go to dissolvingillusions.com, you can see all the graphs in color for free. You can see the author's introduction for free. You can see Jane Donegan's amazing foreword. And I believe you can see all of the photographs and maybe like the first page of each chapter at dissolvingillusions.com.
Yes, and you know what? I just met Jane last week in London, and she's amazing. I really have a lot of respect for her work as well. And so what would you tell a new parent about vaccines?
I would tell the new parent to talk to an old parent, especially an old parent who has children that are 20 years old or higher that they've never vaccinated, and ask them how their health was, how many rounds of antibiotics they had, how many doctor visits they had, how many chronic diseases they have, how they dealt with illnesses when they come up, and I would get a chiropractor on board for your primary care health for your family. And research as much as you can on both sides, because you know the worst thing for me is to see somebody just listen to somebody off the cuff and not vaccinate, and then when the shit hits the fan and somebody gets an infection, they lose their cookies. Okay, you have to know how you're going to deal with infections whether your children are vaccinated or not. So don't think that just because you vaccinate everything's going to be fine. You need to understand nutrition, you need to understand the use of vitamin C, you need to understand what real primary care is, which is actually health care and not sick care, which is what the well baby visits are all about, which you don't need. So I think the most valuable resource to a new parent, it's just like in the old days, it's the older parents who have already been through it and done it, maybe made their mistakes, maybe have 5 kids, 2 that are vaccinated and 3 that aren't, and it's not a coincidence that the ones that aren't vaccinated are always healthier than the ones that are vaccinated.
Yeah. You know, I lived in Europe, and the whole vaccine program is totally different, and that's where I learned kind of to see the veil. I mean, I learned also working for Merck, obviously with Vioxx and stuff like that, but where I saw real health, you know, and health being done. Homeopathy is really big. I was in Holland. I had my son over there in a home birth and everything, and he's completely vaccine free at 6 years old, and he's super healthy.
Yeah.
And it's like, it's night and day. And what we're being told, you know, seeing it from the inside, it's so much about profit, and it really is at the sacrifice of our health. And these well visits, I mean, I think we should just call them vaccine visits, really, because it feels like that's what it is to me. And
well, the thing is, they'll vaccinate them whether they're well or not anymore.
Yeah.
You know?
Oh my gosh,
and some of
yeah.
the worst disasters that we know about, that you hear of the stories that Polly gets on the bus, are people that get vaccinated while their kids are sick, and the doctor says, well, you know, it's probably okay. Don't ever let a needle go into your child when they're sick. That's for sure.
Yeah. And you saw it. I love how your story started when you were a nephrologist at the hospital, right? And you saw it in your kidney patients after flu shots, right?
Well, they told me. I mean, the patient said to me, I was fine until I had that vaccine. So, you know, at first I thought, what? You know, what are you talking about? And so I looked into what's in vaccines and the potential for inflammation, and the case reports that are out there all over the medical literature from decades of people having acute kidney failure after vaccination, after flu shots, which is what I saw. So I started my research there, and it just moved into the childhood vaccines, because you can't see what's happening to the adults and not wonder how a newborn baby or a pregnant mother or 69 vaccines, or doses I should say, of vaccines is going to do in a child, when I saw what 1 dose can do to an elderly person or even just a 40-year-old.
You know what I've been hearing a lot from nurses is that patients are having a lot of strokes in the hospital after they give the flu vaccine, the older patients.
Oh, yeah.
And some of them are coding, and it's
Absolutely.
it's just incredible what they're doing. And I know that the medical community is very brainwashed. I mean, I was as well, working for Merck. But why do you think more doctors and nurses don't wake up when it's right in front of their face?
You know, everybody asks me that question. I think I must have been absent in medical school the day that they did that, you know, that hypnosis technique on everybody that made them believe that everything they did was the best that could be offered, and that the CDC and the World Health Organization can do no wrong. So I can't understand it. I can't explain it, because it's not that the doctors are evil. It's not that they're trying to do harm to people, but they're incredibly impermeable to new information, especially if it goes against what they've already been told. But there were a few doctors who stopped taking their own flu shots, and who, you know, stopped giving their own kids excessive amounts of vaccines. But they still, all in all, believed in vaccination and refused to stand next to me, you know, when I was writing my manifesto about, you know, the problem with vaccination to renal patients. There was nobody that was willing to stand there and say, I agree with her, even though they did in quiet, in you know, behind closed doors. There was some support, but out in the open, nothing.
Yeah, and that's one of the questions I get all the time as well. Why don't more people in pharma speak out? You know, they must see it as well. Why don't more people in the medical communities? And what I experienced was that, you know, pharmaceutical reps and pharma in general has so much power over the entire medical system, over doctors, over hospitals, over the health insurance companies even, and it's crazy. You know, most people who haven't seen it from the inside like we have, I feel like it's harder for them to grasp, even though it's a billion-dollar, multi-billion-dollar industry. It's just seeing it up close was, yeah, disturbing. And I really honor you, because you did speak out, you know, and like you said, there are doctors behind the scenes that thank you and that agree with you, but they won't come forward. And I'm hoping that your inspiration will inspire them to speak out. And I thank you, because it takes a lot of courage and boldness and ethics to come forward. So
I have no actually illusion or hope that doctors are going to start waking up. I really don't.
No?
I saw the potential for that, and I just had to walk away from it. But I think parents waking up, because there are way more parents than there are doctors, and I have seen some parents turn around the minds of some doctors. So I think parents, that's my mission, is to get parents to see, because they're the ones at the interface between their child and that needle, and they're the ones that are responsible when things go bad. So they're the ones that really I am interested in getting them to explore on their own everything the CDC has to say, everything you have to say, everything I have to say, and then coming to their own determination. Doctors, no. I think we just need,
I still had my fingers crossed.
But why? You know what? You really, for the majority of doctor visits, really, they're not necessary. I think it's just better that we abandon them and only use them when they're truly needed, when there's an organ failure, a broken bone.
Crisis care.
Exactly.
Yeah, I mean, that's one of the things I talk about is, the medical system is great at crisis care, but in terms of prevention, in terms of health, I mean, we have a sick care system. We don't have a health care system.
Yeah, I mean, it's not just vaccines that's the problem.
Yeah.
I think we need a safety commission on medical doctors in general, not just on vaccination.
Yeah, I agree. And, but vaccination, one of the things that I've noticed, I mean, that's really the foundation for the house of cards, because it creates lifelong customers in some cases, and usually there will be some issue the more and more and more toxins and vaccines that you get, and that creates a customer base for all of these medications, for depression, for anxiety, for seizures, for type 1 diabetes, all of these things. I mean, and cancer, of course, eventually.
It does, but I really, from what I observe, without those doctors giving antibiotics for every sniffle, every sneeze, every skin infection, those vaccines wouldn't do half the amount of harm that they do. It's a culmination of all the abuses that the medical system has to offer, from conception to birth and the first 2 years. The vaccines are just part of it.
Yeah, I know, it's true. All right, so how can we stop it? What can we do? You talked about the parents. I started learntherisk.org. Everyone go there. I know most of you who follow me know all about it, but we did launch a billboard near CalJam in honor of CalJam, and everyone here, just 2 blocks away. Please help, please volunteer. We're starting chapters in all different states and areas. We have flyers, free flyers to distribute. What else can we do? Dr. Humphries?
I really don't know, because I'm not a politician. I don't know how to move masses of people. I know how to dig up information. I know how to describe what the science that exists and how it doesn't make sense in the way that it's, being abused. And that's really my mission. As far as the bigger picture, I leave that to the attorneys and the parents and the people that are much better at organizing large groups of people. That's just not me.
All right, so Dr. Humphries says that we need to motivate and get out there.
And
it's
are
the parents.
Biggest resource.
It's the parents who are going to change the conversation. I agree, because legislatively, in the courts, we're outmanned right now. It's the parents that have to rise up. And in California, we had 1,000 people go to the Capitol, and it didn't make a difference at all. So apparently, until we're 100,000, they're not going to listen. So please help us get the grassroots going.
Educate yourselves. That's really the best thing, I think, because you're not going to convince anybody else. I mean, your healthy children are good evidence, but you're not going to have necessarily assurance of healthy children if you don't educate yourselves about health and disease, not just about the ingredients of vaccines. That's not enough. You have to understand how to maintain a healthy immune system and spread the word the best that you can in the most grounded, calm, educated way that you can, and it's possible. Any parent can do it. I've seen parents without even a high school education become better able to debate the issues with health and disease and vaccination than a doctor.
Yep, I've seen it too.
Yeah.
All right. So, on that note, healthiness. What supplements should everybody be on every day?
Food, good food, whole food. Organic, if you can, grow your own as much as you can, have backyard chickens, have your own garden, do your sprouts in the spring. And there's nothing like good holistic nutrition supplements. I'm sorry, but there's no way I'm ever going to sign on to the "you need masses of supplements" campaign. You can't eat a garbage diet and think you're going to save yourself with supplements.
True.
Now, even if you're in a healthy state, I don't even believe you need to supplement with vitamin C, and I'm a total vitamin C freak, but I think that if you're eating enough, red peppers and cilantro and parsley and those kind of things that are really rich in whole vitamin C, and you're not sick, you don't have any chronic diseases, you don't need any of that.
Yep. All right, I agree. So thank you so much for joining us. I can't wait until your talk tomorrow. Everybody go to dissolvingillusions.com. And you can see the book also on my website and see talks from Suzanne at learntherisk.org. And also Rising from the Dead is an amazing book that everyone should go get on Amazon and check it out. And thank you. Thank you for joining us. All right, learntherisk.org. Bye.